So, Bismillah, our second topic is of today's the common cold. You most are aware during when the weather changes, when hot weather to cold weather, mostly there is a rhinitis, tonsillitis, laryngitis, pharyngolaryngitis is common. Mostly you have rhinitis is there. नाक बहना शुरू हो जाता है, ये चीजें होंगी जब कोराइजा, most known as कोराइजा. Coryza is a common cold. What it includes? Rhinitis, नाक बहता है, tonsillitis, tonsils inflammation होगी, pharyngitis, गले में pharynx की inflammation होगी, laryngitis, crops ठीक हो जाती है, larynx आपका जो है crops हो गया, pharyngolaryngitis हो गया, ये चीजें आती हैं common cold में. They are in common cold, you can find over there. Then they leads to sometimes flu हो जाता है, sometimes you have to differentiate between common cold and flu. There is flu and sinusitis. ये सारे इसमें common cold में symptom है. There's flu and sinusitis. जैसे if you go through hot weather से cold में जाएंगे तो sinusitis के chances हैं. उस दिन में इससे पहले I was going to हैदराबाद, तो मुझे रास्ते में नूरियाबाद में मैं गाड़ी से निकला तो there was a temperature of 45. तो ठंडक से गया तो when I reached at home तो मुझे साइनस हो गया. मैं I was feeling that क्यों सर में दर्द है. The next I come to know, yes, it is sinusitis. तो जब आप हॉट से या कोल्ड से हॉट में जाएंगे तो साइनस के चांसेस हैं. जब भी आप कभी एसी से बाहर आएंगे तो यू हैव टू, अगर आप अब तो सन में कम हो गए हैं, पहले ज़माने में उनमें एक बफर जोन होता था. When you enter to a cinema, there was a buffer room, buffer होता था. उस बफर में you have to wait for 1 or 2 minutes because when coming from cold, you're entering to that, or you're coming from hot, you're going to cold area. So there was a buffers. So you have to stand over there in a buffer area, so you may not get any common cold or sinusitis, whatever it is. So when you enter from cold to hot, you have to wait. You have to remain at some buffer area, then you have to enter the cold. Otherwise, you can be suffer from a common cold or sinusitis, whatever. So there are the symptoms. Syndrome includes rhinitis, tonsillitis, pharyngitis, laryngitis, pharyngolaryngitis. So in some flu, sinusitis and common cold. Both are in flu. They are symptoms like common colds. Then common cold is that viral infection of the upper respiratory tract. So it is again, it is a common cold, is a viral infection. It's a viral infection. It usually lasts for up to 7 days. As a number of viruses, number is rhinovirus is there, rhinovirus is there, para-influenza viruses are there. They are the causative agents. Still, there are more causative agents for common cold. Season of the year, age, and prior exposure are important factors in the type of viruses causing the infection and the type of symptoms that may occur. Further, we can say mode of how it transmitted, very contagious. So these common cold and flu are contagious. How they spread? It spread from person to person, usually from nasal secretions and from finger of the affected person. Most contagious in the first 3 days after symptoms begin. Viruses can last up to 5 hours on the skin and hard surfaces. Symptoms. It begins with the feeling of dryness and stiffness in the nasopharynx area. Nasal secretions usually clear and watery. Leads further, they go watery eyes, red and swollen nasal mucous membranes, leads to headaches, generalized tiredness, chills in severe cases. It has the symptom of the common colds. You can have an experience of that one. Then they leads to fever in severe cases, exhaustion if the pharynx and larynx becomes involved, sore throats, hoarseness, reported in certain cases. How to treatment? You can give antihistamines, decongestants, pain analgesics, cough suppressant if there is a cough, nasal strips can be given. If antibiotics, but mostly antibiotics are ineffective in these cases. Simply antihistamine drugs, decongestants, analgesics, cough suppressants, and nasal strips has to be used for the relief of common cold. Further, you can they go for treatment. Again, I can say nasal decongestant contains oxymetazoline, phenylephrine. If nasal decongestant, you can spray over there, you can add over there. So nasal decongestants, oxymetazoline, phenylephrine, in analgesics, acetaminophen, ibuprofen, and other NSAID which can relieve the pain. Then take plenty of fluids has to be added when there is a common cold or there is a flu over there. So when to go to a doctor? If temperature over 101 degrees Fahrenheit for more than 48 hours, or cough with pain in the chest, shortness of breath, persistent sore throat without a runny or stuffy nose, then you have to go to a clinic. When to further, if the throat is very red and it hurts to swallow and no improvement within 7 days, severe headache with a fever, worsening pain in one or both ears, any chronic medical conditions, asthma or diabetic, then must consult a doctor. So how to prevention? Good hand washing. Cough and sneeze into arm or tissue, not into your hand. You have to apply aerosol sprays, anti-bac sanitizer X, whatever you have to apply these things. So these are the prevention from the common cold or flu. It's a syndrome, it's a general term of acute inflammatory disease of this upper respiratory tract, such as nasal cavity, tonsil, pharynx, and larynx. So you can compare flu with the common colds. Flu and common cold, how you have to compare. Symptom of flu, influenza, and common colds, you can have symptom of onset, influenza, abrupt. At once you can have runny nose, whatever it is. Common cold, more gradual. Fever and flu, common. Common colds, it's not very common. Malaria, muscles, severe common, uncommon. Arthralgia, joints pain, severe common, and in common colds. Anorexia, in flu, it's a common, and it's uncommon in common colds. Headache, severe, and in cold, mild, uncommon in case of common cold. Further, you can say that cough, dry, in flu, common, severe, mild to moderate, cough in cold. Malaise, severe and mild. Fatigue, weakness, more common than with the common cold. It lasts for 2 to 3 weeks. Very mild and short lasting. Chest discomforts, common and severe in flu, mild to moderate. Stuffy nose, occasionally in case of flu, and common in that common cold. Sneezing, occasional and common cold, yes, it is. Sore throat, occasional in flu, and in common cold. The common old cold may be caused by more than 100 different viruses. You can find the various type of serotype of flu. As there dengue have 4 serotype, here there are 100 different serotype of flu over there or common cold. Having cold isn't very fun, but it goes away in only 3. So there's no need of medication if there is a simple common cold. You have to take symptomatic. You have to care yourself. In Europe, there is no need of treatment. They don't take any medication for common colds. Medication help relieves cold symptoms, but only time. Just when there is a stiffness of nose, there's a pain, then we have to take different type of medicine. Otherwise, they just relieve the symptom of cold. They do not cure the common cold. Many people are convinced that a cold results from what? Exposure to cold weather, from getting chilled or overheated, fatigue or sleep deprivation. These conditions have little or no effect on the development or severity of a cold. Research suggests there can be psychological stress, allergic disorders affecting the nasal passage or throat. Basically, it is a allergic disorders. There can be menstrual cycles can cause may have an impact on the person susceptible to cold. Sometimes they have low immunity, so there are chances of having colds. Up to 6 common colds per year in adults, possibility is there, and 8 common colds in children can be possible 6 times in a year to adults, and 8 common colds per year in children can be happens. Common cold viruses and serotype and cold. In virus, rhinovirus has 100 serotype. In cold, there are 60 serotype. Coronavirus, 2 serotype. Cold has 15. Influenza has 3 serotypes. Cold have 10 serotype. Parainfluenza has 4 serotype and cold have less than 10 are grade of cold. Respiratory syncytial virus RSV is 2 and they are less than 10. Adenovirus 47 serotype and cold have 10. Enterovirus 40 serotype is there and there are 10 for colds. Whenever you have to exhale through these droplets can cause common cold or flu.